Welcome back guys. Now let's see how GFR will be changed in different conditions. How we can change the GFR. Okay. See, this is very important topic which was recently tested in the exam. Now, first of all look at here. Here I am showing you two blood vessels. One is afferent arteriole, efferent arteriole, and in between there is a glomerulus, right? Now, in the first half, okay, four conditions. See, I am showing you four conditions. In the first half, that is the first two conditions, I am going to talk about the afferent arteriole. Okay, that is A and B. I will be talking about the afferent arteriole. See what kind of changes I am bringing for the afferent arteriole. In the first condition, I am constricting the afferent arteriole. See, afferent arteriole is getting constricted, let's say. So now you think logically and tell me, whenever the afferent arteriole is constricted, now more blood will come to the glomerulus or less blood will come to the glomerulus? Less blood will come. So automatically there is less renal blood flow. Okay, the blood flow is getting decreased. The blood flow to the glomerulus is getting decreased because see here there is an obstruction. Whenever you create obstructions, the flow of blood will be definitely less. So now you tell me, whenever there is afferent arteriolar constriction, what do you think will happen to the GFR? Sir, here less blood is coming. Whenever less blood is coming, less will be the GFR. So always remember the substances like norepinephrine and adenosine. Okay, norepinephrine and adenosine causes afferent arteriolar constriction. Whenever afferent arteriolar constriction, what is the result guys? The result is GFR decreases. Renal blood flow decreases, GFR decreases. Exactly opposite. What if the afferent arteriole is dilated? Now see there is dilation, not constriction, dilation. Now the roads are wide open. Now imagine that when the roads are wide, more traffic will go. Okay, the cars are going very speed, there is more traffic going. So now what I am saying, when afferent arteriole is dilated, more blood will come to the glomerulus, more blood will come to the kidneys. So there is increased renal blood flow. So whenever more blood is coming, more will be the GFR. So there are substances called as the prostaglandins. What these prostaglandins will do? Prostaglandins will cause the afferent arteriolar vasodilation. They will keep the blood vessels open. They will let more blood to come to the glomerulus. So GFR will be more. So GFR increases. Okay, done. So first half of the topic completed. Afferent arteriole constriction decrease the GFR, afferent arteriole dilation increase the GFR. Done. Now let's talk about the second half. Means we are talking about the efferent arteriole guys. Okay, efferent arteriole. Now I am using a substance called as angiotensin 2. Okay, which is a product of RAS pathway, angiotensin 2. Now what this angiotensin 2 will do? Angiotensin 2, it is going to act on especially efferent arteriole. See, it is causing what? Constriction of efferent arteriole. Okay sir. So what will happen? Now let me explain you that in the form of a diagram. Let's say afferent arteriole is okay, no problem with afferent arteriole. Now here is the glomerular capillary. Now what happened here? The efferent arteriole, let's say, is constricted. There is severe constriction of the efferent arteriole. Okay, there is severe constriction of the efferent arteriole, let's say, because of high levels of angiotensin 2, there is severe efferent arteriole constriction. Now tell me, so whenever there is a block here, do you think the plasma can exit the glomerulus easily? Do you think the plasma can go out easily? No. So what do you think will happen to the pressure here? Increases. So there is increased back pressure. So first step number 1, there is increased hydrostatic pressure. In the glomerular capillaries, there is increased hydrostatic pressure. Now you tell me, whenever there is more pressure over here, more filtration will happen because the hydrostatic pressure is a favoring force. Whenever there is more hydrostatic pressure in the glomerular capillary, that favors more GFR. So GFR will be more. GFR increases. Now this is what happens initially. Now what happens with time? See, whatever the albumin that is coming over here, do you think this albumin can it exit easily? No, because of the severe efferent arterial constriction, gradually with the time, the albumin will start to build up over here. More and more albumin molecules are accumulating. So with the time albumin is getting accumulated, so what will happen to the oncotic pressure? Because of this albumin, after some time there is elevated oncotic pressure. There is elevated oncotic pressure. So initially hydrostatic pressure increase, but after some time oncotic pressure increases. So tell me, oncotic pressure is what kind of force? Is it a favoring force or opposing force? Oncotic pressure, it is an opposing force for the filtration. Hydrostatic pressure is a favoring force, but oncotic pressure in the glomerular capillary is an opposing force, right? So because of increasing in the opposing forces, what will happen to the GFR? GFR after some times decreases. So initially there is a rise in GFR, later there is a fall in GFR. So this is called as biphasic response. So now write efferent arteriolar constriction from today. Whenever the efferent arteriole is constricted, so initially there is increase in GFR, later there is decrease in GFR. Okay, later there is decrease in GFR. This is called as biphasic response. Okay, this is called as what? Biphasic response. Okay, so biphasic response is seen in efferent arterial constriction with the help of angiotensin 2. Now, whenever you are creating a block, always remember guys, it doesn't matter whether it's afferent arteriole or efferent arteriole, it doesn't matter. Whenever you create a block, okay, so whenever there is narrow roads, do you think more traffic will go or less traffic will go? Less traffic will go. Okay, so whenever you create a block here, do you think more blood will go through the kidney or less blood will go through the kidney? Less blood is going. So whenever there is a block over here, what will happen to the back pressures, guys? There is more and more back pressure. So you tell me, blood always wants to go from high pressure to low pressure. See, whenever there is already high pressure in this area, do you think the blood wants to go into the area where there is high pressure? No, blood doesn't want to go to the area where there is high pressure. Blood always wants to go from high to low pressure. So what I am saying, when you constrict the efferent arterioles, see there are millions of efferent arterioles. When you constrict the efferent arterioles, what happens to the pressure in the glomerulus? There is going to be more pressure. So do you think the blood wants to go to the area where there is high pressure? No, now there is more pressure in the kidney. Now there is more pressure in the kidney. So automatically renal blood flow decreases. So when you constrict the efferent arteriole, what will happen to the renal blood flow? Decreases. So what usually students will think, sir, efferent no constricted, so there won't be any problem with the renal blood flow. No, even if you constrict efferent, the renal blood flow, the amount of blood that is coming to the kidneys will be affected. Doesn't matter afferent arteriolar constriction or efferent arterial constriction. So afferent arteriolar constriction, efferent arterial constriction, both will decrease the renal blood flow. Afferent arteriolar dilation, efferent arteriolar dilation, both will increase the renal blood flow. Okay, done. Now last is, sir, if I use drugs called as the ACE inhibitors, okay, angiotensin converting enzyme inhibitors, what happens? These drugs causes dilation of, they will cause a dilation of efferent arteriole. Okay, now the efferent arteriole is dilated. Now think what will happen when the efferent arteriole is dilated. Look at here guys, afferent arteriole, no problem, glomerular capillaries. Now what happened to the efferent arteriole? It is dilated. Now blood is coming like this and the blood is coming into the glomerulus. Now do you think the blood can stay in the glomerulus? No, it will easily escape because here there is less resistance. Now the blood vessels are wide open, no? So the blood, whatever is there in the glomerulus, it will easily escape into the efferent arterioles. It is escaping. So the blood is moving very fastly. So what do you think will happen to the GFR? GFR decreases. Okay, GFR decreases. Even though there is more blood coming, GFR will be less because here there is less resistance. So blood is moving easily. So there is less hydrostatic pressure developed over here. Okay, it's very clear, right? So blood is not staying here. As the blood is not staying here, the hydrostatic pressure will be less. If more blood accumulates, more hydrostatic pressure. Less the blood, less hydrostatic pressure. Less hydrostatic pressure means the GFR will be less. Okay, so previously I have told you, when you constrict here, there will be more hydrostatic pressure, more will be the GFR. If you dilate, exactly opposite. If you dilate, the hydrostatic pressure here will decrease, so GFR will decrease. So always remember, efferent arteriolar dilation will decrease the GFR. Okay, decrease the GFR. So with this successfully what we have completed, how GFR will be changed with the afferent arteriolar constrictions and dilations and efferent arteriolar constriction dilation. Summary: afferent arterial constriction, simple. Afferent arterial constriction, decrease the GFR. Afferent arterial dilation, increase the GFR. Pass. Now efferent arterial constriction initially increases the GFR but later decrease the GFR. Now efferent arteriolar dilation, simple, decrease the GFR. That's it. Okay. Next, let's see how GFR can be affected with the mesangial cells. Guys, the blood vessel that I am showing here, okay, this blood vessel in the red color, this is your glomerular capillary. Let me write here, this is the glomerular capillary. You can see the fenestrations, these are the gaps, these are the fenestrations, glomerular capillary. Now your glomerular capillaries in certain areas, they are surrounded by mesangial cells. Okay, around the glomerular capillaries, what cells are there? Mesangial cells are there. Your glomerular capillary, they are all surrounded by the mesangial cells. See, these mesangial cells, sometimes they can undergo contraction. They are like smooth muscles, guys. Sometimes they can undergo contraction, sometimes they can undergo relaxation. Okay, sometimes contraction, sometimes relaxation. You think logically and tell me. Imagine this is the glomerular capillary. Here is the glomerular capillary. This is the mesangial cell. If the mesangial cell contracts, okay, the mesangial cell contracts, what do you think will happen to the blood flow in the glomerular capillary? Is it happening? No, because the mesangial cells are contracting, so they are constricting the glomerular capillaries. So less blood will go, so less will be the GFR. So mesangial cell contraction always tries to decrease the GFR. Remember, always tries to decrease the GFR. Exactly opposite. When the mesangial cells are relaxed, more blood will go, so more will be the GFR. More GFR. So mesangial cell contractions and relaxation can alter the GFR. Question is, who will cause the contraction of the mesangial cells? The contraction of the mesangial cells with the help of sympathetic neurotransmitters like epinephrine, norepinephrine. Okay, and relaxation is done by dopamine. Mesangial cell relaxation with the help of which substance? Dopamine, guys. Okay, so with this successfully what we have completed, we have seen what are the different changes in the GFR. Now, how the questions will show up in your exam? Let me ask you, what is the effect of, what is the effect of GFR? What will happen to the GFR in a patient with shock? What happened to the patient? Patient's GFR who is in shock, guys. Now tell me, shock means what? Low BP. The patient is having low blood pressure and the perfusion to the tissues is affected. Means very low blood pressure. The blood is not even going to the tissues. Okay, perfusion is affected. Now in this person, when the patient is already having low BP, is it a good time to lose the fluids out of the body? No, already his blood pressure is less. So you have to increase the blood pressure. You have to increase the blood volume. Now always remember, in a patient who is in shock, do you know what happens? Shock activates sympathetic nervous system. Okay, shock activates sympathetic nervous system. Sympathetic nervous system produces epinephrine, norepinephrine. Okay, epinephrine, norepinephrine. Epinephrine, norepinephrine, what they will do? They will always causes afferent arteriolar vasoconstriction. Okay, afferent arteriolar vasoconstriction. Have I already taught you who causes afferent arteriolar vasoconstriction? Look at here, guys. I have shown you afferent arteriolar vasoconstriction is done with the help of sympathetic neurotransmitters like epinephrine, norepinephrine. So what do you think will happen to the GFR? GFR will be less. So right here, in a patient with shock, there is afferent arteriolar vasoconstriction. So there is decrease GFR. Okay, there will be decrease renal blood flow. So always remember, in a patient with shock, what happens to the blood flow to the kidney? The blood flow to the kidney will be less because that's not the time to send the blood to the kidneys. That's not the time to produce the urine. Okay, so in a shock patient, we will decrease the renal blood flow. We will decrease the GFR. So that is the reason why the patient who is in this shock, the blood flow to the kidneys is affected. When the blood is not going to the kidneys, there is a chance of acute tubular necrosis. There is a chance of prerenal cause of the renal failure. Okay, so this is a very important. Shock patients. In shock patients, there is a decreased renal blood flow. First, the most important thing is the renal arteries will undergo constriction. There is a decreased renal blood flow, and afferent arterioles also undergo vasoconstriction, trying to decrease the GFR, trying to decrease the urine output. Okay, so with this successfully, what we have completed the topic of the changes in the GFR, how GFR can be changed. Hope the video is helpful. See you in the next video with the topic of autoregulation of GFR. Thank you.